Imagine being told for years that your blood pressure must be perfect, only to find out later that lowering it too much could actually make you feel dizzy, weak, or even increase your risk of falls. For millions of older adults, this is not a small detail, it's a life-changing truth. Today, we're uncovering what the best blood pressure really is for seniors, why the old rules don't always apply anymore, and what science actually says when it comes to aging hearts and healthy lives. As we grow older, our bodies change in ways that most people are never clearly told about. Blood vessels naturally become stiffer. The heart has to work a little harder. The nervous system responds differently to sudden movements like standing up. Yet, for decades, many seniors were given the same blood pressure targets as much younger adults without considering these changes. That's where confusion and sometimes harm begins. Blood pressure is measured using two numbers. The top number, called systolic pressure, shows how much pressure your blood puts on artery walls when the heart beats. The bottom number, diastolic pressure, shows the pressure when the heart rests between beats. In younger adults, doctors often aim for around 120/80. But here's the truth, many seniors don't hear often enough. What's ideal at 40 is not always ideal at 70 or 80. For older adults, especially those over 65, the main concern isn't just high blood pressure, it's balance, it's brain health, it's kidney function, it's avoiding sudden drops in pressure that can cause dizziness, blurred vision, or dangerous falls. Research shows that aggressively lowering blood pressure in seniors can sometimes reduce blood flow to the brain, leading to fatigue, confusion, or even memory problems in some individuals. This doesn't mean high blood pressure should be ignored. Uncontrolled hypertension can still increase the risk of heart attacks, strokes, and heart failure. But the key word here is controlled, not crushed. Many experts now agree that for most healthy older adults, a systolic blood pressure somewhere between 130 and 140 can be both safe and protective. For some seniors, even up to 145 may be acceptable, especially if lowering it further causes symptoms. The real problem is that blood pressure numbers don't exist in isolation. A reading on a machine doesn't tell you how a person feels. Two seniors can have the same blood pressure and completely different health outcomes. One may feel strong and energetic, while the other feels lightheaded and unsteady. That's why modern medicine is slowly shifting away from rigid numbers and toward individualized targets. Another important truth is how blood pressure is measured. Many older adults get their readings taken quickly in clinics while sitting stiffly on an exam table, feeling anxious. This can falsely raise numbers, a phenomenon known as white coat hypertension. At home, in a calm environment, their blood pressure may be much lower. This is why home monitoring, done correctly, is often more reliable for seniors. There's also something called orthostatic hypotension, which becomes more common with age. This happens when blood pressure drops suddenly upon standing. A senior might have normal readings while sitting, but when they stand up, blood flow to the brain briefly decreases. This can cause dizziness or fainting and is a major reason why overly aggressive blood pressure treatment can be risky in older adults. Medications play a big role here. Many seniors take multiple drugs not just for blood pressure, but for diabetes, cholesterol, pain, or sleep. These medications can interact, amplifying side effects. A blood pressure pill that works beautifully in a 50-year-old might be too strong for an 80-year-old, even at the same dose. That's why regular review and adjustment are essential. Lifestyle still matters deeply at any age. Gentle physical activity like walking, stretching, or light strength training helps keep blood vessels flexible. A balanced diet with less salt, enough potassium, and plenty of fruits and vegetables supports healthy pressure naturally. Good sleep, stress reduction, and hydration are often overlooked but can make a noticeable difference, especially in seniors. Perhaps the most important message is this: seniors should not chase numbers blindly. The best blood pressure for an older adult is one that reduces the risk of heart disease and stroke without reducing quality of life. Feeling stable, clear-headed, and strong is just as important as what the monitor says. And this brings us to a critical question. How do doctors decide what's right for you as you age? And what warning signs should older adults never ignore when managing blood pressure? To decide what's right for an older adult, doctors look beyond a single blood pressure reading. They consider overall health, daily functioning, and personal history. For example, a senior who is active, independent, and has no major medical conditions may safely aim for a slightly lower systolic number, closer to 130. But for someone who has a history of falls, dizziness, kidney problems, or memory issues, pushing blood pressure too low may do more harm than good. One major warning sign seniors should never ignore is feeling lightheaded when standing up. If an older adult feels dizzy getting out of bed or rising from a chair, this could mean blood pressure is dropping too much. Another red flag is unusual fatigue or weakness, especially after starting or increasing a blood pressure medication. These symptoms are often brushed off as just aging, but in reality, they can be signs that the body isn't getting enough blood flow. Blurred vision, confusion, or trouble concentrating can also be linked to overly low blood pressure. The brain is extremely sensitive to changes in circulation, and in seniors, reduced blood flow over time may affect cognitive function. Some studies suggest that very low diastolic pressure in older adults can be associated with a higher risk of cognitive decline. This is why balance is so important, protecting the heart without starving the brain. It's also important to understand that blood pressure naturally fluctuates throughout the day. It tends to be higher in the morning and lower at night. In seniors, this variation can be more pronounced. Taking multiple readings at different times over several days gives a much clearer picture than relying on a single measurement taken in a doctor's office. Another truth many older adults aren't told is that blood pressure goals can change over time. What worked at age 65 may not be appropriate at 75 or 85. Aging is not static, and treatment plans shouldn't be either. Regular check-ins with a healthcare provider are essential, especially when new symptoms appear or daily functioning changes. Family members and caregivers also play an important role. They're often the first to notice subtle changes in steadiness, increased sleepiness, or confusion. These signs may not seem directly related to blood pressure, but they often are. Open communication between seniors, families, and doctors helps ensure that treatment decisions support both longevity and quality of life. There's also growing awareness that emotional stress and loneliness can impact blood pressure in older adults. Chronic stress keeps the nervous system activated, which can raise pressure over time. Social connection, relaxation techniques, and even simple routines can have surprisingly positive effects. Health is never just about numbers, it's about the whole person. Ultimately, the best blood pressure for seniors is not a one-size-fits-all target. It's a range that keeps the heart protected, the brain well supplied with blood, and the body steady on its feet. Modern science is moving toward this personalized approach, but seniors must also advocate for themselves, asking questions, reporting symptoms, and refusing to suffer in silence for the sake of a number. In the final part, we'll talk about what seniors can realistically do every day to support healthy blood pressure when medication is truly necessary, and how to have smarter conversations with doctors about treatment goals. Supporting healthy blood pressure as a senior doesn't require extreme measures or chasing perfection. It starts with small, consistent habits that respect how the aging body actually works. One of the most powerful tools is gentle movement. Regular walking, even for 20 to 30 minutes a day, helps improve circulation, keeps blood vessels flexible, and supports heart health without stressing the body. For those with limited mobility, chair exercises or light stretching can still make a meaningful difference. Nutrition plays an equally important role. Seniors don't need restrictive diets, but they do benefit from mindful choices. Reducing excess salt helps prevent unnecessary pressure buildup, while foods rich in potassium like bananas, leafy greens, beans, and yogurt help balance fluids in the body. Adequate protein supports muscle strength, which is critical for balance and fall prevention. Staying well hydrated is often overlooked. Yet dehydration can cause blood pressure to drop suddenly, especially in older adults. Sleep quality also affects blood pressure more than most people realize. Poor sleep keeps stress hormones elevated, which can raise blood pressure over time. Seniors should aim for a calm bedtime routine, consistent sleep hours, and a comfortable sleep environment. Even short daytime naps, when done wisely, can help regulate stress without disrupting nighttime rest. When it comes to medication, the goal is the lowest effective dose, not the strongest one. Many seniors assume more medication means better protection, but that's not always true. The right medication plan is one that controls blood pressure while allowing the person to feel alert, steady, and engaged in daily life. Adjustments are not a sign of failure. They're a sign that the treatment is being tailored correctly. Talking to doctors openly is essential. Seniors should feel empowered to ask questions like, "What is my personal blood pressure goal? What symptoms should I watch for? And can we review my medications regularly?" Bringing home blood pressure readings to appointments helps doctors see the full picture rather than relying on a single office measurement. It's also important to let go of fear-based thinking. High blood pressure is not an immediate disaster, and slightly higher numbers in seniors are often safer than numbers that are too low. The focus should always be on long-term well-being, staying mentally sharp, physically stable, and emotionally well. The truth is, the best blood pressure for older adults is the one that supports a full, active, and safe life. Science now recognizes that aging requires flexibility, not rigid rules. When blood pressure care is approached with understanding, patience, and personalization, seniors can protect their hearts without sacrificing their independence. So, if there's one truth every older adult and family member should remember, it's this: blood pressure is not about chasing a perfect number. It's about protecting life, independence, and clarity of mind. As we age, our bodies tell a different story than they did decades ago. And science now agrees that flexibility matters more than strict rules. The best blood pressure for seniors is one that keeps the heart safe without stealing balance, energy, or mental sharpness. It's a range, not a single target. It's shaped by personal health, daily function, and how someone actually feels, not just what a machine says. Listening to symptoms, monitoring regularly, and adjusting thoughtfully can make the difference between merely living longer and living better. Aging does not mean losing control over health decisions. Seniors have the right to ask questions, to speak up about side effects, and to work with doctors as partners rather than silent patients. With the right approach, blood pressure care can support strength, stability, and peace of mind well into later years. Knowing the truth empowers better choices when it comes to blood pressure in older adults. The truth really can protect lives.